项目组的成员，他们通过采访啦，还有就是说座谈会啊，排的就等于说综合出来的3个例子，希望大家来看想一想说，哎，作为老年人的反应。做一些更好的，还有更做就是怎么可以做得更好，包括就是说这个小册子名称是叫《沟通的桥梁》，关于我们能够做些什么，能够倡导人哦。
So my name is Chase Low. I'm the Executive Director of the Chinese Canadian National Council Toronto chapter. And today we have a planning forum, which happens to be on the same day of World Elder Abuse Awareness Day. And this is we call it Bridging the Gap. So this is the results of our 2-year community-based project.
So you're talking about elder abuse. So do you have any findings from the report?
Yeah, so today we have a summarized report of our findings, basically outlining our project. So, you know, the topic initially was elder abuse, but we've expanded the conversation to talk about elder care. So, because elder abuse, as you know, is a very taboo and sensitive topic in the Chinese community, so we've had to look at it in a more dynamic way. So our research really demonstrates that. We've kind of taken the chance to do focus groups, to do surveys, and to do interviews with seniors, caregivers, and also service providers, but really looking at the tensions that exist in the relationship between the caregiver and senior, but also the service gaps that exist in elder care services for the Chinese community.
So any recommendations after the survey?
Yeah, I mean, so you can see in a report, maybe I should show you the report, maybe you can see it here. So this is our report right here. So basically it outlines our findings. So it just shows the method that we use for the research, the findings. So we kind of we tried to sort of organize it in a specific way. So looking at the society, so housing and healthcare, at community level, language, transportation, cultural barriers, household level, poor communication, value differences, financial distress and in-law conflicts, individual level, so social isolation and stress and depression, and the outcomes, so which lead to tensions in caring relationships. And then at the back you'll see our various strategies that we recommend, and they include addressing obviously language barriers, so improving accessibility for Chinese seniors, having a multitude of different languages, so including Mandarin, improving services like transportation, tackling that we need to have accessible transportation for seniors, so having certain hours where maybe they can have free transportation or discounted. Looking at the education of service providers, them needing to understand Chinese culture and also just the complexities of that. The Chinese community is made up of different communities, people from mainland China and people from Hong Kong, and taking notice of that. So we have a number of outlined recommendations in here.
What kind of solution are you proposing?
Well, that's, I'm hoping today will be an event that we can actually, because today we actually have a number of policymakers, service providers, and also government officials that we're engaging with our recommendations. So today, actually, the goal is to actually engage our participants to figure out what those next steps are, because these are people who are actually in charge of impacting and shaping elder care services in Toronto. So this is what today is about. So we'll see. We'll see what happens.
Such a survey comes out on the market?
There have been some studies for sure on elder abuse, but this is one of the few studies that actually look at a more expanded version of what we're trying to do. So we're not just looking at the result of elder abuse, but what actually leads to elder abuse, and that's why we've expanded the conversation to look at elder care.
When you look at, say, elder community like Chinese, will there be a language or the cultural barrier or the major causes of those abuse or what?
In terms of services, the gaps and the barriers, for sure, it's the cultural and the language barriers. But in terms of the relationship between the caregiver and seniors, it's a number of things. It could be a generational barrier. It could be, there's been instances where seniors are brought over to take care of grandchildren, but so they're financially dependent on their children. So that doesn't allow them to be independent. And then, there's some the challenges there, and they experience isolation, they experience depression. So there's a number of factors that for sure happen.
Last question. In your report, did you say that the ratings by the user or recurring services?
Our focus groups involve discussions of that, the sort of gaps, like what are the services that are existing, but also what needs to be improved. So you'll see in the report there's certain quotes from our participants who've actually made comments towards that.
So it can be improved.
For sure, most definitely.
有一些都是比较困难，确实意识到这也是